Now, one goal of this COVID vaccine is to keep you out of the hospital if you do get the coronavirus. The last year and a half, hospitals have been stretched. Doctors and nurses are exhausted, sometimes to the breaking point.
Our talented reporter Dustin Grove has been talking to the men and the women who've been working on the front line every day for the past year and a half, and now brings us this very unique look at what they still face when they go to work every single day.
Inside the ICU at Community Hospital South, Marcus Guajardo is fed up, not with the nurses he supervises or the patients under his care, but with a virus that won't go away.
We see death daily. We see it all the time.
On this particular day in late September,
it's very important that you spell it correctly.
As schools returned to in-person learning and sports fans were back in the stands, life for most of us seemed to be almost back to normal. But at the hospital,
we are still in a fight.
11 of the 12 ICU beds were full, 8 of them COVID patients.
We're exhausted mentally, physically, just exhausted.
What can I do to help you get out of this room?
18 months into the pandemic, his nurses still work nonstop and often see little relief.
They can't have a family member in there with them. They're alone. And
you're it.
Yeah, we're it. So we're playing nurse, we're playing family member, loved one, kid, chaplain sometimes, dietary, doctor. I mean, we play all the roles.
I lie in bed awake at night just thinking about what the next day is going to bring. What can I do to help my staff? What can I do to help the patients of the hospital? And how bad is the next day going to be for us?
Managers like Marcus are focusing more than ever on emotional assistance for their employees. They're also encouraging frontline workers to take time off. But hospitals, still packed with patients suffering from COVID, find themselves facing a potentially catastrophic symptom of their own. Some nurses are so burned out, they're considering taking off and not coming back.
She told me that she has seen too much death, that she loves being a nurse, she loves being in healthcare, but she had to do something else other than being an inpatient nurse because of all the death that she's seen over the last year and a half.
Tonight at 11, we're taking you alongside nurses on the front line to see what they are still facing, the impact it's having at home, and the one thing they say we can all do to help. Inside the ICU, tonight at 11 on 13 News.